A deep dive into the world of psychedelics, hosted by Ben Brooker. You're with Friends in High Places.
So Shevaugn, what's a few things that people should know about you in terms of where you've come from, what your practice is, and where your interest lies in relation to psychedelics and altered states of consciousness?
Well, I come from Canada originally, so I did my nursing education over there, did a degree in psychology, and then I came over here to do a PhD on clinical psychology. And while I was completing my PhD, which was on body dysmorphic disorder, I became very interested in the use of psychedelics, psilocybin in particular at that time, and its therapeutic benefits. I uncovered that there was all of this literature that existed, and the psychedelic renaissance that sort of started around the 90s. And so I hopped onto Google and I'm like, is anyone in Adelaide researching this or know anything about this? This is fascinating. And that's how I came across my friend Chris Lethaby. And so we caught up, and eventually he invited me to a reading group that he was part of, where we would review academic papers on psychedelics. And yeah, I just sort of became, connected with more people who are doing amazing work in this space. And yeah, in terms of altered states of consciousness, I think I've always been quite fascinated by them. I like to meditate quite a lot and do certain, breathing exercises that might induce those kinds of states, done some yoga. And I just think that there's a lot of healing potential in the mystical experience.
Yeah, I mean, I don't think I've spoken to anyone about psychedelics who's kind of working in the field in a similar way to you, who hasn't had a lifelong interest in altered states of consciousness, including myself. And I'm someone who came to psychedelics relatively late in life. But I realized recently that, when I was much younger, I was fascinated in altered states of consciousness, more kind of generally defined. I was obsessed with dreams as a young person. Would do really quite dangerous things in school, like the choking game. We might have talked about that before.
Yeah, I've done that as well.
You've done that as well?
Yeah,
so I think it's interesting that for a lot of people, that kind of interest seems to precede the interest in psychedelics rather than the other way around.
Yeah, absolutely. I remember being an 8-year-old kid and taking out books on Buddhism and just writing down these quotes. And it's just a different way of perceiving the world, and I just think that it creates a lot more meaning and connection, like with yourself and with nature, and just mindfulness, generally speaking, just ways to expand the mind and enhance the mind. It's an interesting area.
Yeah. Well, Paul Lignatsky, who we both know, said something similar to me, that when he was young, he used to be obsessed with this picture in a book that he'd found of sort of monks meditating, and a very similar thing. And he said for him, those images were like of superheroes, or they were that equivalent for him. He was so taken with that sense of, I guess, the sense of transcendence that he was getting from those images.
Yeah.
So very similar.
Yeah, it was just this instantaneous connection. It really resonated. And then I just forgot that I had that spiritual side to me until, maybe 4 or 5 years ago. And it was a process of rediscovering, which I've learned, I think, along the years, that the personal or spiritual journey is more about unlearning and kind of shedding the layers of conditioning and kind of getting back to the core of who you always were, but you kind of forgot about, in a sense.
It's interesting. You're a nurse, you're a clinician, you're an academic, and yet you seem to be very comfortable using terms like spirituality.
Yeah.
And I think not everyone in your field would, and I know that I've had to overcome deep discomfort with labels like that because of the kind of person who I am. I tend to intellectualize before I'll kind of emotionalize an issue, for example. So yeah, I guess, were you always comfortable kind of talking about altered states of consciousness and psychedelics in that way, as kind of spiritual induction methods, if you want to call them that, as opposed to simply instrumental or medical ones?
Yeah, I don't think that I've ever had a problem with it. And any time I'm talking about spirituality with a client, I will let them know what I mean by that. And what I mean by that is just a deeper sense of connection with myself, other people in the world, and we'll explore, if they're interested in spirituality, what that means for them. So of course it's really important not to impose your own belief systems on people. But I think what's largely missing in a lot of the sort of postmodern psychology is that deeper part of what it means to be a human being. Like Marsha Linehan, who developed dialectical behavior therapy, predicated a lot of her work on her training in Zen. And there's a lot of interest now in somatic experiencing, which is, deeply spiritual, and there's a lot of wisdom, the wisdom of the body. And I think that we are turning a corner now, and it's starting to become more accepted and introduced within the context of different therapies.
So I feel like we should say something about where we are.
Yeah.
So we're kind of in a forest, or it's a parkland.
Mm-hmm.
Don't quite know how to describe it. There's a creek behind us.
Yeah.
We're sitting in this beautiful, it feels like a glade. I don't know what a glade is, but I kind of want to say it's that.
Let's call it that.
Let's call it that. So where are we and why are we here?
Right. Well, I used to live not too far from here. It's sort of close to the university that I studied at. And my roommate and I sort of discovered this path one day. And it's a really special place for me. I've been in altered states of consciousness just under this tree, more than once. There's someone, I don't know who it was, put up this beautiful hammock. And so I used to lie in the hammock and, have sort of ego dissolution types of experiences and different kinds of mystical experiences. So I'd sometimes come with friends, and then at some point in the journey would sort of, split off, and then I would just come and, do my own thing. And there's something about this tree. I have a bit of a connection with this tree. Mm-hmm. I really love it. Yeah.
And does that go to what you were saying before about kind of connection and spirituality?
Yeah.
I quite liked your definition of something spiritual being just a kind of another way of framing a kind of deep connection to self and maybe to nature as well.
Yeah, absolutely. I think that what I've come to learn over the years in working with a lot of people who suffer is that at the root and core of a lot of suffering is a lack of connection. We live in a very individualistic society, and we've lost connection with other people, and especially, of course, with the COVID pandemic, that certainly doesn't help things. I mean, just having to be at physical distance, with one another, not being able to, travel and connect and see family members, or it's awkward, like, can I hug you? Can I not hug you? Mm-hmm. So there's just this inherent lack of connection that I find that exists within people who are really suffering. And so I think that when you have a peak experience, a mystical experience, it connects you with a deeper part of what it means to be a human being. And it's beautiful. And when integrated properly, it can have really enduring effects.
So it sounds a bit like Johan Hari's idea that, what does he say? The opposite of addiction isn't sobriety, it's connection.
Yeah, absolutely. Addictions, it's like a classic example of that. It's just trying to escape the self, right? The body becomes a really uncomfortable place to be. At the core of many addictions are people who are traumatized. And working with, a lot of trauma patients, that's essentially what they're doing a lot of the time, is just escaping the body. And so in an altered state, in a mystical state, it's interesting, you can have this simultaneous sort of disconnection from body through a process of ego dissolution, but then when you come back into it, you feel more connected with your body. It's sort of like that reset mechanism, I guess.
One of the things that I find really interesting about psychedelics is their kind of paradoxical nature. And I think you were kind of touching on that there in terms of talking about how, they both seem to be connecting agents and agents that pull you much closer into yourself. And those things seem to be certainly not mutually exclusive. They seem to be always at play in psychedelic or transcendent experiences.
Absolutely. I often talk about the nothing everything continuum. And I guess what I've realized through getting older, having more of these mystical experiences, is that they appear paradoxical when you are perceiving reality from a dualistic vantage point. And I'm not saying that this is the correct way of perceiving reality, but the way that I've come to see it is through the lens of non-dualism, in that everything, oh gosh, this sounds a bit corny, but everything is one, you know. And so I just see this sort of infinitely expanding continuum. And sure, if you look at maybe opposite ends of that continuum, things can appear to be in juxtaposition, you know, with one another. But I think that it really does all belong to the same spectrum.
So what about ego? Because you mentioned ego dissolution a bit earlier, and it is something that people often point out with psychedelics is, yes, they're agents that can dissolve the ego and put you into this kind of place of, I guess, like an eyeless self in a way. But at the same time, we know that psychedelics can also be quite aggrandizing, and you can, you know, get people, you know, who have, if anything, an inflated ego after, you know, using these substances a lot. Does that feel like, is that another kind of paradox of psychedelia to you?
I think that it's probably a pretty accurate perception. And I mean, you do see megalomania running rampant, you know, in the psychedelic space. I've seen it more times than I would like to admit. But at the same time, it can be an incredibly humbling experience. And I suppose that psychedelics are largely just an expansion of consciousness that is maybe already there. So, and I guess it's so individual. I mean, just the neurobiology from one person to the next can differ vastly, not to mention, you know, all of the life experience that a person has had up to that point. And so I think that you do see very different reactions and almost paradoxical reactions, as you pointed out.
I mean, does this go to the idea of psychedelics being like non-specific amplifiers, you know, they've been called?
Yeah.
Going to what you were saying about how maybe they just kind of blow up whatever was existing there in the first place. And I sometimes think about that in terms of, you know, people talk a lot about, and we've spoken about it, the ability of psychedelics to ferment increased kind of connection to nature. But is it also the case, and I suspect it is, that people who are predisposed to being connected to nature will more likely take psychedelics in the first place? Do you know what I mean?
Yeah.
So again, do you have, is it that psychedelics is kind of planting that seed, or is it more that they're kind of bringing something out that was pre-existing to that?
I mean, it may very well be a little bit of both. It may be that it is sort of watering the seed that was already there to begin with, and I think probably in some circumstances it opens the mind up to novel ways of perceiving reality that perhaps weren't there at all before. So it probably largely varies case by case.
Yeah. I want to talk about the megalomania that you mentioned just before. I don't know if you're listening to it, but there's a podcast out at the moment called, I think it's called Power Trip. Which is, it's kind of about the dark side of psychedelics and the unethical behavior of some therapists in this space. It's a really kind of dispiriting story to anyone who, you know, sees a lot of love and connection in psychedelics as we do. But I wonder if, there's anything you kind of want to say about, I guess, the dangers of psychedelics from that standpoint. And I think one of the concerns for me is the susceptibility of psychedelics. People enter into a very vulnerable state, I think, when they're on some of these substances, and that can open the door, I think, to some really bad behavior, shall we say. And, you know, you were saying that you've encountered those kinds of megalomaniacal people in this space, I suspect probably mostly men. But, you know, let's talk about that as well, because I find that interesting. One of the sort of standard protocols now for psychedelic trials is that there'll be a male and a female therapist in a room with a patient. And people don't often talk about why that is. It's assumed that that's because it has some therapeutic utility, but I've been told by other people it's actually a kind of safety mechanism, so that you don't have, you know, one therapist and one patient, which obviously sets up a very different sort of potential for abuse of that power relationship.
Yeah, look, I think most things in life aren't without risk, and because of the fact that psychedelics do tend to render people more suggestible, it does put them in a highly vulnerable state. And in the wrong hands, that sets the stage for not only adverse reactions, but potentially, unethical behaviors on the part of therapists. And that has happened. I've been reading a bit of content on that. And, you know, of course, it's really unfortunate, but, you know, it's a reality that people have sort of abused their positions of power, as unfortunately therapists, medical doctors, and people in, you know, higher level professions have abused their power and, you know, had sexual relations with clients before. So it's unsurprising that that would happen in the context of the psychedelic space, given that it happens in the context of therapeutic space anyways. And, you know, I don't want to give the misconception that it's a really common thing, but the reality is that it can and it does happen.
Sure. So, I mean, I think in your, you know, in your professional life, you are a psychedelic integration therapist. Is that the right way of putting it, more or less? So let's talk about integration, because, you know, many people will say that it's such a key element of the psychedelic experience, but maybe one of the more poorly understood elements. I've spoken to researchers in this space who share my frustration with the way psychedelic science is sometimes communicated to the general public. And I think there's often this perception that, you know, someone has a mental health disorder, they're given ecstasy, and then they become better. And there's no discussion of the therapy that, of course, is an essential component of that. And then the integration that happens afterwards as well. So can you talk a little bit about, I mean, specifically integration, but maybe some of those other aspects as well, if you want to.
Yeah, sure. So when I refer to integration, what I mean by that is, well, providing a space for people to come and know that I'm not going to judge the fact that they use psychedelics, and I'm not going to, you know, give them a weird kind of look or sort of convince them that, you know, this is a bad thing to do. But also by integration, what I mean is largely a harm reduction approach. I do see people who have had very adverse reactions to psychedelics, which has unfortunately, you know, continued on for years afterward. And so what I've found is that providing psychoeducation in and of itself can be incredibly useful, and exploring, you know, certain themes or maybe symbols that have sort of emerged during that experience, and just through the process of Socratic questioning, so you're just sort of, you know, asking questions to elicit information, explore with the person sometimes different ways of perceiving it. There have been some instances where a person is able to look at the experience and reframe it a little bit differently, acknowledging that, some dark stuff came up and it was difficult, but there were actually also some useful things that came up, and how can we then sort of integrate that into their lives. But of course you get people who have had really great experiences, and so they might have, you know, certain archetypes or imagery that comes up for them, or maybe certain insights, and again, through the process of Socratic questioning, unpack that a little bit more. And you are using, you know, evidence-based therapy to, you know, consolidate maybe useful insights that may have come up for them. So again, dialectical behavior therapy, I find, because it does incorporate a lot of mindfulness and wisdom-based teachings, that's a really good approach to use. Acceptance and commitment therapy is a very creative, sort of flexible kind of therapy. And, you know, cognitive behavior therapy, all sorts of different therapies really complement that process. So as an example, you know, I might have someone who had a mystical experience, certain images may have come up for them, certain insights, maybe they had an insight about acceptance. And so, you know, ask them to keep an integration journal, sort of draw out some of the information and create a bit of a meditation exercise using those symbols that may have come up for them, or doing a mantra-based meditation of acceptance as you breathe, you know, in and out. So you want to, or at least for me, you want to be embedding it within the framework of evidence-based therapies that already exist, but being really flexible with it and being really creative with it, which is why I really like ACT, acceptance and commitment therapy, because it does encourage therapists to get creative, like encourages the use of, you know, drawings or music and different, like the use of metaphors, and I think that fits really nicely within the framework of psychedelics.
So I'm curious as to sort of how you go about opening space for the people that you see to bring their own kind of framework of meaning to those experiences, because people I know who have done psychedelics have sometimes said to me, you know, I sat with someone and they kept telling me that, you know, this thing that I was experiencing meant this, and I wasn't comfortable with it. Do you know what I mean? And I think there is that risk that outside interpretation can be a real kind of block on people's integration processes.
Absolutely. And with any good therapy, we're trained to ask questions. We're not trained to give advice necessarily. I mean, sometimes, sure, but we know that the best way for a person to learn and have lasting change is for them to uncover the truth within themselves. And people are intelligent and they're wise, and I think it's really important to guide the focus inwardly and to assist the person on that path, but to not do too much hand-holding, if that makes sense, not too much advising.
So you mentioned an integration journal as one tool that you recommend clients to use that word to use. Is that something that you would would you keep such a journal over the course of a psychedelic experience, or is it something that would happen afterwards, or is it both? How does that work?
So, of course, we're not encouraging people to go out and use psychedelics. We just recognize that people are already doing this, right? And so after, all the harm reduction stuff is done, it's like, okay, well, you know what, if you're going to be doing this anyways, it'd be a good idea to, keep a diary and record what's coming up for you. Because, akin to a dream, if you don't write it down or at least talk about it right away, it kind of fades. Right? And I think that anyone who's had altered states of consciousness, an epiphany during a meditation, or even visual imagery, astral traveling in meditation practice, you can have these insights, and if you don't write them down afterward, you kind of lose them, similar to a dream, I think. And so I think in these altered states, that's what happens oftentimes. People can have all these insights and these images emerge, and if they don't integrate it, they don't reflect on it, write it down, they forget it.
It's one friend of mine who told me that she has this problem, and she's used a lot of psychedelics, and she really struggles with this aspect of integration. Because I asked her about this, and she basically said that she's never really integrated her experiences, and her kind of reasoning was that essentially life is so busy and I'm so swept up in everything else that I in a way don't get the chance to sit down and really unpack these experiences.
Yeah, absolutely. And I think that it's a lot easier to reach enlightenment when you're a Buddha living in the forest, right? We live in a highly stressful, fast-paced, industrialized society. And so it can be confronting sometimes to come out of a mystical experience and then out into the real world, and the busyness of life and the this and the that we have to do. So it really just comes down to, what do you prioritize, right? And making it a habit, because we are creatures of habit. So if you make the integration practice a habit, then it just becomes second nature. And I mean, there's all sorts of ways of doing it. You can journal, you can meditate, you can, start listening to even like certain podcasts, Alan Watts, like Eckhart Tolle or Thich Nhat Hanh, just further consolidating the wisdom that we all have within us, that primordial wisdom that's sort of infinitely accessible to all of us.
So it feels like this is a good point to talk about meditation. So I know that's something you've done a lot of and are very interested in. Does that kind of feature in your integration practice, or does that kind of sit slightly alongside it? How do you view that?
Yeah, I often meditate with clients in the session, and I love to actually, if they're comfortable, get on the floor with them, and like I've got a little salt lamp in one of my offices, and put that on and do a meditation, and it can be incredibly helpful. And again, that's part of dialectical behavior therapy. You do meditation, all sorts of different kinds of meditations with them, and looking at the literature, I find that mantra-based meditations, loving kindness, expanding awareness, at least there's some research to show that it does tend to have similar effects on the default mode network that psychedelics do. And so I think it's very complementary to go into that space.
In terms of, obviously you can't talk about specifics, but I'm just interested in kind of some of the cases that you've dealt with, and the sorts of examples of kind of psychedelic use that you've seen. And I think, you mentioned that you've had experience with people who have maybe had long-term kind of negative after effects from psychedelic experiences. What can you kind of say about that, and what are the harm reduction aspects that you would kind of highlight?
Yeah, well, there's a lot of underground psychedelic spaces happening, right? And I would say that not all of them are overly ethical and aren't giving the full picture of what these substances are and what to expect. And a lot of the adverse reactions that I've seen have come from people who just simply aren't educated, who are not aware of what it is they're even taking, who aren't aware of the importance of set and setting, you know, using it in the context of like a party setting with people that they don't really know, and you know, there's already underlying trauma there. And so it can be a very confronting and, you know, scary experience for them, especially if they're on a psychedelic like ayahuasca or LSD, where, you know, the effects last for such a long time. And so I think a lot of it does come down to the preparation and how knowledgeable the person is of the substances, and really, like, I guess it's informed consent and the importance of informed consent. And then of course you have people who have a history of psychosis or immediate family members with psychosis, and I've seen ongoing, you know, psychotic reactions following the use of psychedelics. And again, I don't want to put the word out there that's super common. From my clinical experience and what I see in the literature, it's not super common, but it does happen, and I have seen that. And there's also HPPD, you know, hallucinogen persisting perceptual disorder.
Yep.
So it's not without risk, and I think it's just really important that people are fully informed, that they're aware of the potential therapeutic benefits, that they're aware of the potential risks. And also we have to be mindful of, you know, the research that we've seen primarily where benefits have been found are within the context of controlled clinical settings with, you know, highly trained people. And so I think that a lot of people maybe just have this sort of rose-colored glasses approach to psychedelics and think that, you know, it's going to cure, you know, all of their problems just by virtue of consuming it. And I'm not saying that people can't benefit from recreational use. I've also seen that. But I think it's just really important to look at the bigger picture and recognize that, like all things in life, you know, there's good and there's bad and there's everything in between.
Sure. So what's the distinction that you make between recreational use and spiritual use, I suppose, or maybe there's another term that you use? Is it just a matter of intention, or is it more complicated than that?
Well, I guess when I'm referring to recreational use, I just mean outside the context of trials, and
Right.
I don't think of recreational as a bad thing, like, oh, it's just party, party, party. I think that yes, it can certainly be used differently under the umbrella of recreation. It can be used in a party-like setting. And it can be used in more of a ceremonial, ritualistic, spiritual setting. And yeah, you can obviously get very different results depending on how you are going into the experience and who's around you and what's around you.
One of the other aspects of integration that really interests me is sort of how do we take insights that we might have coming out of psychedelic experiences into not just our lives, but into the world in a more general sense. And to explain, I think one thing that I think about quite often is, as you would know, one of the main clinical focuses at the moment is on the potential of MDMA to treat veterans with PTSD. And, you know, one of the parts of that conversation that I feel like we never have, because it's almost like, you know, I worry about a sort of depoliticization in a way of psychedelics, because to me, I think if we're going to have a conversation about veterans and PTSD, we actually also have to have a conversation about sending soldiers to fight wars that they shouldn't be fighting in the Middle East, for example, right? Because surely that's one way to treat trauma in a sense before it even happens. And that's not an argument, obviously, against the use of MDMA for PTSD, which I think is incredibly significant and important, and I think we should be doing that. But I guess my point is that you know, whoever said that thing about, you know, being well adjusted to a sick society is not something that we necessarily want either. So do you know what I mean? I guess it's a question around, you know, how, you know, what insights might psychedelics be able to offer in terms of changing society as well as individuals? Maybe that's what I'm getting at.
Sure. Well, look, I very much agree with what Jordan Peterson says. If you want to create change at a systemic level, let's start with your own bedroom, right? Like, you have to do that inner work first, right? Because I think what happens with a lot of people, and I mean, I've certainly done this in the past, is that we focus on the issues on a macro level, and you know, and we want to do something about it, and that's a beautiful thing. It's not a bad thing by any means, but if you don't even have your own bedroom in order, you're not going to be able to affect anything on a systemic level. So I think first, as you know, Gandhi said, be the change you want to see in the world,
Right.
and that can be incredibly impactful. Right, you know, the butterfly effect. Like, it's amazing how many people's lives that you can affect just by cleaning up your own bedroom, right? And that inner bedroom, that inner space, right? Because, you know, love it's infectious, right? And a person who is truly self-actualized, it's infectious, and we're mirrors of each other. So I think that we really have to first start with cleaning our own inner spaces before we sort of look at things from a larger systemic global perspective.
Sure. And I wonder if one of the problems with kind of psychedelic insights is that the people who have them in that moment, they feel incredibly profound and important. But afterwards they can feel really banal in the cold light of day.
Yeah.
Is that a kind of problem that you encounter with people that you see? Do they kind of struggle with that aspect of it? Because, you know, it's, you know, everybody can kind of agree on some fairly mundane level that, you know, love is everything, or we're all connected. But obviously under the influence of psychedelics, that those sorts of insights have much more salience, to use a Chris Leatherby word.
Yeah.
Which is very hard to get across to people who are not inside that experience or haven't been inside experiences like that.
Yeah, absolutely. And again, working with people who have used psychedelics, you know, recreationally and outside the context of trials, that's one thing that's definitely come up before, which is, you know, I'm having all of these profound insights and realizing that I don't want my life to be about money. I don't want it to be about materialism. But then you come back into this sort of materialistic society, and let's be honest, it's not easy to drop everything and go live in the forest. Like it on the surface might sound this easy thing to do, but it's not impossible. So I think that people can become quite disillusioned sometimes, and it can be quite a confronting contrast, you know, to be having all of these insights and realizations about where you would like your life to be and who you would like to be, but then you know, come out into a society that doesn't always facilitate that. And I think that's what we've seen in, you know, some of the Carhart-Harris trials, where I think they've done really amazing work with you know, individuals with treatment-resistant depression, but they're not always seeing, you know, enduring effects. And, you know, we think that that's largely because they're going back into that same environment, and, you know, eventually they just become reconditioned, and those effects kind of wear off.
Right, and I think that goes to exactly what I was saying before, which is, you know, it's all very well perhaps kind of, you know, sort of, you know, reshaping the way that you think about yourself or the world. But if the world is remaining kind of stubbornly what it always was, and if that is the source of your discontent in one way or another, then it's a very different sort of process of integration in a way, isn't it? It's not maybe just about you understanding yourself at some kind of, you know, psychological level. It's about you trying to fit perhaps a new model of yourself into that pre-existing model that you're talking about, which at the moment we know is highly neoliberal. It's highly destructive and stressful on mental health, on the environment, on many things. And as you say, not everybody is in a position to drop everything and you know, go and live in an ashram or whatever. You know, maybe we should, but you know, that's not an option for everybody, certainly.
No.
So I guess how do we then live in that knowledge? And that's a big question, but
yeah, no, that's okay. And again, I think it starts from turning the attention inwardly and looking, I guess, almost from a pragmatic vantage point. Okay, well, if these are some of the insights and realizations that I've had, how can I action that on an individual level and keep redirecting the focus, you know, more on an individual level? Because I think that we can get really caught up again in that macro level conceptualization of how the world should be, and that's a recipe for, you know, disillusionment and discontentment. So I think it just, what can I do in this moment, right? And maybe you can't do anything in this moment, so can you accept that, right? Because I mean, one of the fundamental lessons that come up in the psychedelic experience is acceptance, and it's at the core of a lot of different really good therapies as well. So I think it really just keeps coming back to what you can facilitate on an individual level, right? Just sort of like honing it in a little bit.
Right. And acceptance is, I mean, it's a really core precept, isn't it, of both psychedelics and meditation practice. I'm certainly not an expert on meditation by any means, but, you know, my kind of layman's understanding is that it's very much about, you know, being able to sit in the moment and, you know, let thoughts be what they are rather than be kind of chasing them or interacting with them. And, you know, it's, you know, very often said that that's the best way to approach psychedelic experiences as well. Very common idea that if something kind of dark or disturbing comes up, that the most effective thing you can do is actually go towards that thing and say, well, why are you here? What do you have to teach me? Why aren't I having a different experience right now? And I think that's, to me, that's a really kind of fundamental part of the psychedelic experience. And I'm guessing the meditation experience as well.
Yeah, absolutely. You know, acceptance and surrender within the context of the psychedelic experience when you are confronting something dark that exists within you is fundamental to moving through that pain and that suffering. We get really good at trying to skirt around our suffering, and that's what happens when we're resisting what's coming up for us. Maybe we're not ready to look at that shadow aspect of our nature, right? It can be very confronting, right? But it's only when we go into it that we're able to come out of it, I think. But yeah, like acceptance, it's about learning to accept the things that you don't have control over, but then exercising control where you do have it and being in alignment with that, because we expend a lot of energy resisting reality, resisting the things that we don't have control over. And it's futile and it's exhausting, it's completely illogical, yet we do it all the time. So it can be really useful to just start with the small things, you know, You're caught in traffic, right? Rather than screaming at the person and, you know, pounding your hands on the steering wheel, can you just do a little bit of a breath meditation? Can you just notice what's around you? Can you just unconditionally accept that moment? Because if you don't, the only thing that serves is the influx of cortisol being released into your body, and you know, you get all sorts of inflammation issues if cortisol keeps getting dumped into the system. So yeah, it's really, I think what it comes down to is just not expending energy where it's unnecessary to be expending your energy.
Yeah. And at a sort of deeper level, you know, Paul Luknatsky has talked to me about his view of kind of how psychedelics work, and his sense is that at the heart of it, it's to do with how psychopathology works and how it manifests, which is essentially going to some of the issues that you're talking about around avoidance. And, you know, often, and this is imperfectly understood, but it's believed that it's only by kind of facing and kind of exploring and kind of letting go of difficult feelings through a kind of cathartic process can we actually become mentally well again. And a lot of people believe that, you know, psychedelics kind of, in a way, they're a bit of a shortcut to that. Meditation can achieve it maybe over longer periods of time. But is that your sense as well of maybe why psychedelics are effective in treating mental health disorders?
Yeah, I think so. I think that unlike a lot of the other drugs, it's not escape, it's a process. I mean, sometimes it's escape maybe, but oftentimes it's the process of moving closer to the suffering.
Do it, but maybe if you could just talk us through it, and maybe just say something as well about why meditation might be important in terms of integration more broadly.
Well, I guess as I've become a little more experienced as a therapist, I've learned the importance of not ignoring the body. You know, I think as psychologists, we often ignore the body in the same way that modern medicine often ignores the mind. But the mind and body are intricately interconnected. And I mean, Buddhists have been saying this for a long, long time, but we know now with neuroscientific evidence that that's actually true, right? So I think it's really important to work with the body, and meditation is one way of doing that. And as I'm kind of doing this on the fly, but as we'll probably do, I think, is you know, locate, for example, a specific emotion. It's important to name the emotion that you're experiencing. Many people struggle with that, and you can't regulate your emotions if you don't know what it is that you're feeling. And emotions can sort of be held in different points of the body and experienced viscerally. For example, you know, if I'm feeling angry, I may feel it predominantly in my chest. If I'm feeling sadness, you know, I might feel, you know, a heaviness. And so it's important to work with the embodiment of emotions. And I think that meditation allows that, because it allows you to focus your attention into the body, like moving through those emotions. And yeah, I think that that's really important. It's important, of course, to take into account cognitive processes, but I also think it's important to take into account body.
Sure. So would you like to run through something with us now?
Yeah, sure.
Great.
So I guess just as an example, if I'm working with somebody and let's just go, or I'll ask you, is there a particular difficult emotion that you've been struggling with lately?
As a parent of a 4-week-old, extreme tiredness.
Yeah.
But I think you know, some difficult things came up for me today, actually, in I guess the business of being a father and adjusting to, you know, lack of sleep and feeling, you know, incompetent and incapable of looking after this completely helpless life form. And so I think, I don't know if I'm talking around it. I don't know what the exact feeling is, but it's something to do with, I think it's interesting that you say that, because I think actually one of my problems is that I can take a long time to locate the source of feelings that I'm experiencing. And so it's often interpreted when I have an argument with someone, people think I'm sulking, because often I'll just kind of stop arguing. I'll reach this point and I'll take myself off into another room and just kind of sit there for 15 minutes. But what I often explain to people is often I don't actually know what I'm feeling in the moment, and I kind of, there's something in me that wants to intellectually fully understand the thing that I'm feeling before kind of talking about it.
Sure.
And then after I've kind of had that time away, often I can come back and say, okay, I think this is why I reacted in the way that I did to that thing that you said. Does that make sense?
Absolutely. Yeah, that makes sense, right? So perhaps you are quite identified with the logical part of the mind, because what I'm hearing are thoughts, right? I'm incompetent, for example, right? Now, when you tell yourself that you're incompetent, and that might be a core belief that you have, it likely elicits a particular emotion, right? And so perhaps for now, if you can't put a name on it, what we can do is just locate where that, it's not really a feeling, but we'll call it a feeling of incompetence, and just sort of explore, you know, where that's held in the body. And then afterward, you know, we can sort of, if you're comfortable.
Yeah.
Okay. Yeah. Have a conversation about, you know, well, viscerally, what did that feel like for you? And perhaps, you know, we may be able to arrive at a place where you may be able to identify the specific emotion, right? But yeah, it's not uncommon that people can really struggle with that. And I think men in particular, not all men, but a lot of men, because men are sort of socialized to suppress their emotions or not express certain emotions because it's not perceived as, you know, masculine. And from my perspective, that's really sad, because as human beings, I mean, we have emotions for a reason. So I find, you know, particularly with men, they can struggle to identify their emotions.
Right. I think I'm a very typically socially conditioned male in that sense.
Well, fair enough. We'll see what we can do then.
Right.
Okay, so you just want to sort of sit as comfortably as you can. Right? If you're more comfortable, you could sit on the ground, doesn't matter. But you can sit like this. And so when we get into difficult emotional states, our bodies tend to react, right? And so our posture can change. For example, if I'm feeling really stressed, I kind of like close into myself. So it's important to have that body awareness. And so it can be useful to sort of slowly plant your feet into the ground and just try to sort of straighten up the back and the spine as we do this. But just, you know, sit as comfortably as you can. So just, if you don't mind, just closing down the eyes. And what we're going to do is we're going to start by directing the attention to the toes, and we're going to gradually work our way up to the crown of the head. And as we do this, I'd like for you to please just locate that feeling of incompetence. So just try to think back to the most recent time when you got this sense of being incompetent, and just notice where in the body that manifests for you personally. And it might manifest in more than one point in the body. You don't have to verbalize anything to me. We'll talk about it after, but I'll sort of guide that experience as we go through. Okay? So just start by directing the attention down to the toes. You're just going to hold your awareness on that area of the body. Slowly and gradually work your way up toward the ankles, and just slow down the breathing as we go through this meditation. It can be good to breathe in for about 4 seconds, breathe out for 6. You always want to try to breathe out longer than you're breathing in, so that we can activate the parasympathetic nervous system. And bringing the awareness toward the lower legs, just holding your attention on that area of the body for a moment. And if you find your mind wandering at any point, just notice that. Let the thought come, let the thought go, just like a wave coming and crashing, and redirect your attention back to the center point, back to the body. Sending the awareness now toward the knees, just holding your attention there as you continue to breathe in and out, slowly and mindfully. So you gradually make your way to the upper legs. And sending the attention toward the hips. Make your way to the stomach and lower back region, paying particular attention to the torso. These are common areas that difficult emotions are held. Again, we're just locating that sense of incompetence in the body. Now sending your awareness to the mid-back, sternum, just keeping your attention there. And then gradually sending their awareness to the upper back and chest. Again, if your mind wanders at any point, just allow the thought to come and go, and redirect your attention back to the center point. Sending the awareness now toward the shoulder blades. If you're noticing any tension there, you might want to just bring those shoulders down. And moving the awareness down through the upper arms toward the elbows, forearms, wrists, palms of the hands, fingertips. When you're ready, gradually send the awareness back up through the arms, making your way to the shoulder blades. Moving the attention now toward the neck and throat, just sustaining awareness. And when you're ready, send your attention to the jaw, noticing any tension there. Sending the attention now to the mid-face. Toward the eyes. And finally to the crown of the head. Now I'd like for you to please direct your attention to the lowest point of the body. That feeling of incompetence was held. And just sustain awareness. Try not to label as good or bad. And just take notice of how it feels in the body. Now, if you're able to, picture sending a bright white light through that area of the body, allowing that light to envelop that feeling of incompetence. This is a light of unconditional love, compassion, and acceptance. The light is not here to condemn the feeling. It is here to deeply understand it with the utmost compassion. Keep sending that bright white light through that point in the body. As you continue to breathe in and out. And when you're ready, if that feeling was held in more than one point in the body, bring your awareness to the next highest point. And start by sending that bright white light through that point of the body, enveloping that feeling of incompetence. Allow the light to hold space. Allow that feeling to be. Again, if your mind wanders, let the thoughts come and go. And redirect your attention back to the center, back to the body. If you notice any resistance, try to maintain an attitude of openness and curiosity. And if you can, surrender to the experience. Continue sending that bright white light through that point in the body. Now, if you're able to today, see if you can release just a little bit of that feeling of incompetence from those points in the body. Perhaps you picture giving it to the earth, giving it to the wind, giving it to the water. See if you can give yourself permission to release just a little bit of that feeling from that point in the body. Do not force it out. If there's too much resistance, you might just continue to send that bright white light through those points in the body. Or perhaps you sustain your awareness. But if you're able to today, continue to release more and more of that feeling as you give it to the elements, to the earth, to the wind, to the water. If you're able to release more and more of that feeling, you might start to notice a vast empty space opening up inside of you. This isn't emptiness in the pathological sense. This empty space is useful. You can use the empty space to fill your needs with. For example, perhaps you fill the space with unconditional love, unconditional acceptance, unconditional compassion. Whatever it is that you need in this moment, picture filling that empty space with your needs. We'll take 5 more slow rounds of breath here. For the duration of the exercise, listen to your intuition. Perhaps you simply sustain awareness on those points of the body. Perhaps you'd like to picture sending that bright white light. Perhaps you'd like to continue releasing that feeling. You give it to the elements. Perhaps you hold in mind that infinitely expanding empty space. And perhaps something else comes up for you. Two more slow rounds of breath here. Sustaining awareness and the wisdom of the body. Last in breath here. And on the last out breath, you can slowly reawaken your body. And when you're ready, you can open your eyes, just returning your attention back. How did you go with that?
That was big.
Yeah?
Yeah.
Are you comfortable sharing your experience? Yeah.
Yeah, a lot of interesting things happened.
Great.
I think almost firstly, I just became much more conscious of my surroundings. And I think must be a beehive near us.
Yeah, I noticed that as well.
The first time, and
yeah.
a different bird song,
Yeah.
splashes in the creek, all stuff that I wasn't conscious of before. So that in itself was kind of really nice. And I guess it was interesting with your invitation to think about that difficult emotion when you asked me where I might locate it in the body. Immediately I knew where it was, and it was here. It was kind of lower chest. It felt very specific somehow. I don't know why, but it was just a strong intuition that I had. My mind definitely was wandering. I'm a very kind of on-off meditator, and I haven't done it for a long time. I think that's partly why, because it's sort of, I find it very difficult to kind of still my mind in that way. So I definitely felt distracted, although less frustrated at that distraction than I sometimes am.
Great.
I think there's something about it. This is a very kind of calming place, and the breeze is lovely, and all those, the kind of oral landscape that we were talking about was really nice. So yeah, I think all of that helped.
Yeah, great. Yeah.
What was it like for you, if you don't mind me asking?
Oh, I found it, quite peaceful, especially because this is my space, and I love it here. And I very much agree. Became quite aware of the nature that surrounds us. I think there's some little like geckos in here, or what are they called here? The little
skinks.
Skinks. Yeah, and I became aware of
mosquitoes.
And mosquitoes.
I don't know if I was being bitten before, but I was certainly being bitten while I was meditating.
They always get me. They love me for some
me too.
reason. Yeah. So we were just becoming more aware and felt very, very connected to the moment, I would say. Yeah. Yeah.
Well, thank you, Shevaugn.
Yeah.
That was a great conversation, and
thank
the
you.
meditation was excellent to do as well.
Thank you.
Really appreciate it.
Yeah, no worries.
Created on the land of the Ghana people. Technical production by Edwin Kemp Attrell. Supported by Replay Creative. Music by Lazy Susan.